This is Breakthroughs, a podcast from Northwestern University Feinberg School of Medicine. I'm Erin Spain, host of the show. Atopic dermatitis, or eczema, affects about 10 million children in the U.S., and the itching that accompanies this condition can cause pain and distress for kids who can't always verbalize or quantify how much they're suffering. But a new wearable sensor developed by Northwestern University scientists could help better monitor scratching and assess the effectiveness of therapies for eczema and other conditions that cause itch. Dr. Steve Zhu joins us today to talk about the wearable sensor and the critical role it could play in bringing much needed relief to these patients. Dr. Zhu is an assistant professor of dermatology, pediatrics, and biomedical engineering, and the medical director of the Query Simpson Institute for Bioelectronics at Northwestern. Welcome. So nice to have you on the show.
Thank you for having me.
You know, we actually met several years ago when you were a resident here at Northwestern. Tell me a little bit about the evolution of your career over the past 5 years or so, from resident and postdoctoral fellow to a physician, scientist, engineer who's developing devices such as this scratch sensor.
Well, it's been fantastic. I think Northwestern is such a special place, both as an academic medical center, but also as a university, as a community that really cultivates collaboration and translational work and reaching across the aisle between different departments to be able to solve really, really meaningful problems. So it was really formative, for me as a resident at the McGaugh Center, training in dermatology. And then I had the opportunity to do a postdoctoral fellowship with Professor John Rogers, who I think is the leading kind of academic engineer when it comes to all of these technologies. So I did okay enough to stay on in the group. And as sort of a translational physician engineer, I get to do what I love here at Northwestern, which is to take advances in engineering, both from sensors to machine learning, and apply them to really significant unmet clinical needs. And quantifying itch is one of those needs that I think, we're making some headway here with this manuscript and this sensor.
I'm excited to dive into the results of this study and science advances. And, Dr. John Rogers may be familiar to a lot of our listeners. He's been on this show several times to talk about these wearable sensors. You were actually part of one of the projects that he came on the show to talk about, which is a wireless sensor system that's used to monitor premature babies in the NICU. I'm wondering, what has drawn you to not only using this sort of technology and understanding it, but specifically in pediatrics and working with children?
Well, I think for pediatrics, it's extra meaningful because that's an area that really has been limited in regards to innovation. Kids unfortunately don't have a lobbying group. The market is considered much smaller than adult indications. There's challenges on the regulatory side for pediatric devices, although there's some very meaningful, initiatives by the FDA to correct that. So when it comes to innovation across all of medicine, there's a lot of problems, but I think there's an extra value to addressing those towards things that cause suffering in children, especially those that oftentimes they themselves do not have a voice.
Well, in atopic dermatitis or eczema, it truly can impact quality of life for children. Tell me about that. How does it impact children specifically?
Well, atopic dermatitis or eczema, I think in some ways in the media, it gets portrayed as, oh, you have itchy skin. It's annoying, right? It's embarrassing. But that's it. There's a lot of TV shows that kind of characterize, eczema in that way. But if you look a little bit beneath the surface, especially us as dermatologists, it's a disease that causes tremendous suffering. And it's so common that if you multiply that, it's an enormous amount of suffering. Patients with atopic dermatitis, these kiddos, they just don't have just itchy skin. They lose up to 1 night per week of sleep compared to their peers. When you think about how critical sleep is to neurodevelopment, to school performance, that really adds up. It's a really, really huge problem. I think a lot of people will be surprised to know that patients with eczema, they have a 44% increased risk of suicidal ideation, and they're 36% more likely to attempt suicide compared to those without the disorder. So, this is not a condition that just causes itchy skin. It leads to difficulty sleeping, difficulty concentrating, neurodevelopment challenges, skin pain, as well as skin itch. And then also, the itch being so bad that, a lot of these patients have an increased risk of suicidal ideation and suicide attempts. attempts. So, I think it's a condition that deserves a lot more respect, right, than simply that of just itchy skin. It causes a tremendous amount of suffering for both children and adults worldwide.
Sure. And the caretakers of these children, too, I'm sure are feeling some of this when their child can't really explain how much it's impacting their life, or they're trying to help them through treatments. I'm sure parents are feeling this as well.
Eczema is not just a condition of an individual, it's a condition of families, because it is predominantly a pediatric condition. I think when you look at the disease, if a baby is not sleeping well, no one in that household is sleeping well.
Explain the scratch reflex that comes with eczema.
It's interesting because, we're very familiar with pain, right? That's one of the most common, sensory kind of outputs that our body has. When we're in pain, the reflex within the spinal column is to retract, right? You touch a really hot stove. What does the reflex do? It pulls your hand right out of the stove before you even know what's happening, right? So that's really pain. And so if you look at itching, which is really kind of, the sister of pain in some ways, it's, the second, if not the most common sensation we face when it comes to pathologies. The reflex is to scratch, sort of relieves the itch momentarily. And so, it's a reflex that happens much like, the reflex for pain is to withdraw. The reflex for itch is to scratch.
And you've said, understanding how often someone is itching and measuring itching and atopic dermatitis, that could be just as important as measuring glucose levels for a diabetic. Tell me more about what you mean by that.
Absolutely. So I think when it comes to, where we are in healthcare, right, it's all about personalization. It's all about better tracking of outcomes, right? If you can't measure it, you can't manage it. And when you think about something like itching, right now, the state of the art truly is to ask, right? It's a survey. It's a quiz. And, those things can be helpful. Don't get me wrong. Your individual perception of itch, via a survey or a scale is really important. But that's harder to do when you're a 4-year-old or a 5-year-old, right? It's harder to do, to kind of get that measurement on a continuous basis, right? And then have it be objective and repeatable. So being able to measure something kind of accurately, repeatably, objectively for all individuals that are affected by the disease is really important. And I like to use the example of diabetes and measuring glucose, because the ability to measure glucose in a continuous way, some of these continuous glucose monitors, has really revolutionized the ability for certain individuals with diabetes to better manage their own health, to better take control of what's going on, to know when to implement certain therapies, to know the consequences of diet or decisions. And I think that measuring scratching for patients that have atopic dermatitis can represent that level of transformation. Just like we measure blood glucose or hemoglobin A1C for patients with diabetes, just like we measure blood pressure for patients with hypertension, this is another example that happens to be in atopic dermatitis.
So as you said, right now, children are typically, it's sort of a self-reported, how are you feeling with the itch right now? And tell me, how are the children typically treated? What's happening right now with treatments for eczema?
Yeah, so it is an exciting time for eczema, actually, atopic dermatitis. The traditional treatment, which is still really the mainstay, is topical corticosteroids, topical steroid products, and they're very effective for many, many patients. Applying that to the skin can reduce the itch, the inflammation, and help with healing. But for a lot of patients, it's not enough. There's a need for something stronger, more systemic. And the recent kind of approval of dupilumab, which is a monoclonal antibody treatment, has been quite transformative for a lot of patients with severe atopic dermatitis that's not controlled by topical steroids. And we're seeing that being tested in smaller and smaller, younger age groups. But then beyond dupilumab, there's dozens of other medications are being in development for atopic dermatitis. So it's a very sort of exciting time. I mean, for decades before dupilumab, there were no approved drugs, for this condition. Now we're kind of in a space where there's a lot of activity, and that's great for patients. It's great for dermatologists, and it also opens up the greater need for objective outcomes, like measuring scratch as an assessment of itch. And that's why I think this publication is quite timely.
Let's get into that a little bit. First of all, for those who don't know and they haven't heard our previous podcast with John Rogers. Go ahead and describe the sensor technology that we're talking about.
Yeah, in a nutshell, it looks like a Band-Aid. And it's soft, it's flexible, you forget that you're wearing it. It couples to the skin very gently. Patients with atopic dermatitis obviously have sensitive skin. So it's like putting on a gentle Band-Aid and forgetting about it. And then that sensor, when placed on the dorsum of the hand, is able to capture not only the motion of scratching, which is actually not enough to accurately quantify, but also the acoustomechanic signatures, the high frequency signatures that happen when your fingernails and skin scratch another part of your skin. That information is transmitted through the bones of your hand directly into the sensor. And it's impervious, actually, to outside noise. It's not a microphone-based technology. And that's really helpful because for many people, they don't want to be recorded at night or recorded at all. So this sensor kind of gives you the ability to accurately quantify scratching without any of the privacy concerns.
So explain the results, which you recently published in Science Advances.
Absolutely. So what we did was the study was done in two parts. The first was in healthy normals. So just asking normal patients just to scratch and basically follow a standard protocol. And that's what we use to train our machine learning algorithm so that it learns, okay, this is not texting, this is not typing, this is not waving, it's scratching. And then we took the algorithm and the sensor and actually deployed it in the clinic. And we actually did it in children, those with moderate to severe atopic dermatitis or eczema, 11 of them. They generated more than 300 hours of total scratching data. That's actually a lot of data looking at the previous records. And that was meticulously labeled by some of our co-authors, identifying when scratching was seen on an infrared camera set up at night while the subject was wearing our sensor. So when the patient was scratching at night, we actually would go back and look at the video and say, okay, in that instance, did the sensor pick up scratching compared to what we see visually? And 84% of the time it did. And the overall accuracy was 99% because when you were lying still, the sensor was not falsely saying you were scratching. And so this is pretty significant results, probably the most accurate in the most number of patients reported with these kind of devices and tools. So we're very proud of that. And the algorithm that we developed was completely separated from the cohort that we ultimately tested it on. So there's a clear separation between the data the algorithm was developed on and then our clinical results, which is really the best way to do it.
And parents were really your partner with this. You basically sent them a package of technology, including an infrared camera and the sensor. Tell me about the role the parents played.
Parents were heroes. I mean, I think that if you think about having a patient with, moderate, severe atopic dermatitis as a kiddo, they're itching, they're sleeping, they're trying to get through their day and go to school and such. There was a lot of commitment on the parents' part to set up the infrared camera. I think putting on the sensor was actually the easy part, to be honest, but they were really committed to the work. And I think that speaks to how much a lot of these parents suffer, all the work that they have to do and how much they want to have more objective data to know that a certain medicine is working or that maybe their kiddo is making a left turn and maybe we got to be a little bit more aggressive with the moisturization or the bleach baths or things like that hopefully will prevent from getting worse earlier than simply saying, oh, my kiddo's really itchy today or scratching a lot more.
So you experimented, you mentioned this sits on the skin like a Band-Aid. You also experimented with mounting the sensor on an Apple Watch as a comparison. How did that work?
Well, we wanted to show that the sensor does more than simply measure motion. So previous studies have really focused on wristwatches to kind of quantify scratching. And they don't really actually measure scratching. They're really measuring motion of the wrist. And if you think about scratching, a lot of individuals only scratch with their fingers. So if you look at your wrist while you're scratching with just your fingers, it's not moving much, right? And so these watches kind of miss these really important motions that are indicative of scratching. So it doesn't make them quite accurate. So we sort of demonstrated in various activities that we can pick up scratching very sensitively, but also specifically. For instance, we would scratch in the air with our hands. That's not real scratching, right? You're just doing the exact motion of scratching. And that would look identical to the wristwatch, right? Of course it does. And our sensor is able to differentiate those two behaviors just to give a more accurate measurement. And, that's important because if you're going to develop a drug, right, that's a multi-billion-dollar sort of effort and these kind of things, you want to make sure that the tool that you're being graded on is measuring what you're saying it's measuring.
And the children, did they tolerate wearing the sensor and having the camera in their room and being a part of the study? How did they tolerate this?
They did great. I mean, the kids were the real heroes here. We had a few false starts. We had to, turn down the brightness of the screen, but we were able to figure that out. The sensor is soft and flexible, so it's really designed to be ultra gentle. Similar sensors, like you mentioned earlier, have been used in the NICU. So, we know how to design sensors with ultra gentle adhesives. In fact, you don't even need an adhesive to kind of put the sensor on with a little Band-Aid that goes on top, a little wrap, an ACE wrap that people use for, various musculoskeletal injuries. So, ultimately it was very well tolerated. Even in this population, we had no dropouts. We had no skin-related adverse events. So we're very proud of that too. So it's measuring things accurately, but also not doing any harm at all.
So this sensor was accepted into the FDA's Drug Discovery Tool program. Explain that program to me and how exciting it is to be a part of that.
It's incredibly exciting. I mean, it's part of, one of the main advantages and reasons why, this technology is so needed is to help new drugs get through, right? To be able to quantify and show people that scratch, activity reduces, right? With the implementation of a efficacious drug. So, it's a competitive program. The FDA is obviously a very busy agency with a lot of important things to do, but this Drug Discovery Tool program is funded by the 21st Century Cures Act, and it's designed to allow innovative technologies to be implemented in clinical trials to accelerate getting good drugs on the market. And so we're really excited to kind of gone through that process. We submitted a long application that's reviewed by the FDA, and only those that are the most, merit worthy, those that are really addressing an unmet need get accepted, and sort of provided with the resources, et cetera, to get this moved forward. The FDA even provided us a grant, actually, to kind of further the validation of this. And this paper is really like a key step in that process. So we're very proud of that. We're excited to be working with the FDA. Very excited to be working with several pharmaceutical partners in, getting these devices deployed.
You've said that eczema really impacts children the most, and some children end up outgrowing eczema, but there is no cure and it's often chronic and can flare up again later in life. Can this technology help adults too with this condition?
Absolutely. So eczema is not just a disease of children. It predominantly affects children, but up to 4% of adults have atopic dermatitis. And the success of dupilumab in adults, it was approved for adults first, has really underscored how, this condition is very common and it causes a lot of suffering in adults as well as children, So it's not just limited to adults. But then I think I'll make another point. There's many, many conditions that lead to itch, lead to very, very significant itch. Renal failure, liver failure, certain lymphomas and cancers. These kind of things can be very debilitating. The itch is really the predominant driver of suffering for a lot of these patients outside of eczema. So we think there's a lot of opportunity for this sensor to be deployed and usable across many conditions, not just skin ones.
Are there any plans to use the device right now, or is it being used right now, or in any other upcoming clinical trials?
Yes, absolutely. So we, again, like I mentioned, have several pharmaceutical partners developing medications for atopic dermatitis. We're also looking at other skin conditions that cause itch, like psoriasis, for instance. And then we're also looking towards the future, things that are related to renal disease or kidney disease, and liver disease. So I think there's a lot of opportunity to demonstrate this device to be kind of useful across any condition that causes itch. And I'll make one sort of point that up to 1% of all sort of medical visits on the outpatient side, itch is a symptom that was identified by patients, 1% of all medical visits. So, it's very common. So I think this is sort of a tool that could be useful across many different conditions.
Is there anything else that you'd like to share?
I think the key thing here is that this is really an effort that reflects team science, and really the best part of, Northwestern, again, is the collaboration here. So there's engineers like Professor John Rogers, there's dermatologists like myself and Amy Poller, there's machine learning scientists, mechanical engineers, medical students, research assistants. So I think it really has allergists, they have all really kind of come together to kind of make this happen. And that's what we aim to do.
Well, thank you so much, Dr. Steve Zhu, for joining me today. I know this is not the last time that we're going to have you on to talk about this sensor technology, so I look forward to future conversations as well.
Thank you for having me.
Thanks so much for listening to the show. You can always head to our website, feinberg.northwestern.edu, to listen to past episodes of the show, claim CME credit, and subscribe. Subscribe on Apple Podcasts or wherever you download your shows so you never miss an episode. Thanks for listening.